overview about global call for cervical cancer elimination. So before that, we must understand the difference between elimination and eradication. Remember, for cervical cancer, we are talking of elimination, and elimination means you have to continue all the intervention to eliminate the disease in the subsequent generation. And whereas eradication means you stop all the interventions, and even after stopping all the interventions, no cases are being reported. So the example of eradication is smallpox eradication. So the WHO has declared this as a public health problem, and it has set the goal of cervical cancer elimination by 2030. And why we are having so much focus on cervical cancer? Because worldwide, one woman dies from cervical cancer every 2 minutes. Cervical cancer kills 300,000 women each year, and together we all can stop this. So where we currently stand at global level, at global level, cervical cancer is the 4th most common cancer among women, and one life is lost every 2 minutes, as I have already said. Importantly, it is the leading cause of cancer deaths in women in 36 countries. In 2020, the global mortality statistics increased to over 340,000 women, and these are likely to continue to grow, particularly in underprivileged and vulnerable communities. Current data suggests that 90% of all cases of cervical cancer, they occur in low and middle income countries due to largely poor access to screening and early detection and treatment of both pre-cancer stage and when they are diagnosed with cancer. 9 in 10 cervical cancer deaths worldwide, they occur in low and middle income countries. Women living with HIV are 6 times more likely to develop cervical cancer compared to those women who are HIV negative. So this is the Golobocan A standardized incidence rate. And what is this Golobocan? You all can see that this is a window-based software which provides access to the worldwide database of cancer incidence and mortality rates. So you can see that the data country-wise from 2008, then 2012 and 2018. And as Saraya Madam has already said, we are on the declining trend, but still much needs to be done. We have come from 27 to 21.9 to 14.7. And this is the A standardized mortality rate. Here also, we have gone down from 18 to 12.4 to 9.2 in 2018. So this is just the figures and charts to make you understand that really why WHO has declared cervical cancer as a public health problem. Here are some statistics. You all can go through these statistics, and the percentage of countries with HPV vaccine in the national immunization schedule, if you see by this World Bank income group, then definitely high income group, there is more HPV vaccination as compared to the low income countries. And that is why in India, as our President Dr. Pai has already said, that now we have convinced our government to include it as national vaccination programs. If you see this percentage of country-wise, the diagnostic and other services as far as cervical cancer treatment is concerned, you can see again that high-income countries are definitely having better facilities for treatment and better prevention strategies and screening strategies. Cervical cancer is preventable. When it is detected and managed at the very earliest stage, it has over a 93% cure rate. That is why worldwide, everyone is emphasizing on screening for cervical cancer. Nearly 90% of women who die from cervical cancer, they have poor access to prevention, screening, and treatment. And here, Dr. Saraiya Madam has already said that ASHA workers are contributing a lot towards this to reduce this gap between the access and treatment. Vaccination of young adolescent against HPV is the safe and it prevents cervical cancer. And what is this WHO call? What is this global strategy for elimination of cervical cancer? In nutshell, it is 90% coverage of HPV vaccine of girls by 15 years of age, 70% coverage of screening, that is 70% of women should be screened with high performance test by the age of 35 to 45 years, and 90% of the women who are identified with cervical disease, they should be able to receive treatment for precancerous lesions or invasive cancer. So every country must introduce and scale up HPV vaccine, HPV screening for women between 30 and 49 years of age and ensure appropriate treatment and follow-up. So this is the global strategy, that is 90, 70, 90. And this strategy has got three pillar strategy, that is prevention through HPV vaccination, screening and treatment of precancerous lesions, and management of invasive cancer, which includes the palliative care in advanced stages as well. So the strategy again emphasizes on 90% of girls being fully vaccinated by 15 years of age, 70% coverage of screening with, remember, high performance test between the age of 35 to 45, and 90% of women should be identified as precancerous, as well as 90% of women should be identified. If they are identified, they should be managed. So WHO has set the goal. More than 190 countries, they are signatories to this declaration and they have committed to the achievement of the target. And the first of this target is, of course, 90% girls to be vaccinated, which is really an achievable target. And now the cost of HPV vaccine in India is also going down and down so that it becomes affordable to all. And if it is included in the national vaccination program, then definitely each and every girl will be vaccinated with HPV vaccine. And if we can do this, see how many deaths can be averted. Vaccination of girls alone can avert death to the magnitude of 0.1% to 61% in 2070. And if we continue and scale up, then by 2120, HPV vaccination alone can avert 90% of deaths related to cervical cancer. FIGO has already joined hands with WHO and together they are committed to solving the preventable tragedy of cervical cancer by 2030. We at Foxy ICOG, as I already said, Foxy is doing a massive work as far as cervical cancer elimination is concerned. Dr. Pai and Dr. Madhuri Patel has already told you about all the work which has already been done by Foxy. And during this Badlao initiative of Dr. Pai, he is putting in massive efforts and energy to this WHO call of cervical cancer elimination. And we as ICOG, that is academic wing of Foxy, we have started doing this preventive oncology course to sensitize our members and to increase the awareness amongst our own members towards cervical cancer elimination so that they can pass on the benefit of this awareness to their patients. So we are here on this platform of Foxy ICOG to scale up the vaccination program, to scale up our screening test, and to provide services to those women who are diagnosed as pre-invasive or invasive cervical cancer. Many other international organizations, they have already joined hands with this WHO call. So friends, through cost-effective evidence-based interventions, including HPV vaccination of girls, screening and treatment of precancerous lesions, and improving access to diagnosis and treatment of invasive cancers, we can eliminate cervical cancer as a public health problem and make it a disease of the past, as Dr. Saraiya has said, because really, it being a preventable disease, we want it to be a disease of the past. So achieving the 90-70-90 target by 2030 would result in over 62 million cervical cancer deaths averted by 2120. So friends, let's join hands. Together, we can eliminate cervical cancer by following only these 3 basic steps, that is prevention, early detection, treatment, and of course, awareness, which we all are creating through this platform. So thank you so much for your patient hearing.